Well, good evening, everyone, and welcome to TRIO Philadelphia chapter, Transplant Recipients International Organization. I'm your host tonight, Bill Soloway, president, and this is our May 2022 meeting. We're still under this COVID stuff. It's on again, off again, and now we're dealing with monkeypox. So more on that later. But tonight is a topic that I really appreciate and always can never listen to this enough, because now that we're heading into the unofficial start of summer this weekend, the Memorial Day weekend, it's always good to have dermatology visit us and talk to us about us being so special because of our meds and how we have to be extra special in taking care of exposure to the sun, because we all like to go to the shore and the beach and be outside and, you know, wearing the floppy hats and the right sunscreen and clothing and everything. So it's a pleasure to have with us tonight both Naomi Herr and Beth Hayward from Penn Medicine Dermatology. And between both of them, they have over 15 years of experience in diagnosing different types of skin cancer and managing skin conditions specifically and exclusively, no, not really, but I like to think so, for us special solid organ transplant recipients. So with that, I am going to turn things over. Naomi's running the PowerPoint tonight and Beth's tag team. And so let's see what they have to say, and then we will open up for questions. So if you have a question, maybe even put it in the chat, right? And if it's something that I see, I'll go right to asking them. And then of course because this is such an intimate group, we will open it up for questions afterwards. So with that, I want to turn things over to Naomi and Beth. Welcome.
Thank you. Thank you for having us. We love doing this talk. We find it super important for organ transplant patients. May is Skin Cancer Awareness Month. So to, I think, finish up May with this talk while, like you said, Bill, going into the summer, it's really, really important to know a little bit and just refresh so you remember to get your sun protection going for the next few months. So I am going to share my screen here. I'm going to switch over here. And can everyone see the presentation?
Yes, looks great.
Perfect. All right, so we're going to start here. And Beth and I are going to do a little tag teaming. So you'll see us kind of going back and forth, but it'll be perfect and you guys will love it. So skin cancer after transplant. Biggest thing is, why does it happen to you? What you need to know, how do you protect yourself, and how we have to kind of do our due diligence if you've had an organ transplant moving forward. Oh no, sorry, it's not moving. There we go. So Beth and I are part of the Penn Dermatology Oncology Center. What this is that we are made up of a few branches here. So we have the pigmented lesion group, which is our physicians who specialize in melanoma. We have the Mohs and Reconstructive Surgery Clinic. They are our surgeons who, unfortunately, some of you have met or have not met, but they will be the ones who do a lot of the treatments necessary for skin cancer. We have our rare and inherited skin cancer clinic. That is our clinic that has to do with the oddest skin cancers and the most rare ones. A lot of times they have some sort of genetic component to it. So we have a few physicians who study that specifically. And then here we are, and who you guys tend to see is myself and Beth. Dr. Catherine Steele, if you've met her, Dr. Thuzar Shin, Dr. Giordano, a bunch of the Mohs surgeons. We're all part of this high-risk skin cancer clinic for organ transplant and immunosuppressed patients. So let's talk skin cancer and organ transplant patients. So skin cancer is the most common malignancy after organ transplant. Why do you ask that is? Well, let's see if it'll go. Sorry, so we have this picture here of the general US population and your lifetime risk of skin cancer. So about 2 in 10 people will get a skin cancer throughout their lifetime. But with organ transplant patients, what we see is that this changes to about 5 in 10 of Caucasian transplant patients will develop a skin cancer. So the risk is pretty high there. Compared to the general population, it's a substantial increased risk of skin cancer. And why that is mainly actually because of a few factors. So we're going to talk about the risk factors for skin cancers, how to prevent skin cancers, and know how to detect them. So the higher your risk, the more vigilant you need to be. So we talk about skin cancer in transplant patients. One, we have this picture here of patients who are already at high risk. So we see all different kinds of ethnicities, different color skin, different types of people, but fair skin has the higher risk for skin cancer. Now, in our organ transplant patients, although this is still true, the reason that this risk increases for our organ transplant patients is because the immunosuppressant medications you're on, so a few of them kind of can rev your risk for skin cancer. That includes tacrolimus, Cellcept. We also look at medications like azathioprine, voriconazole. If you've been on those are very sun sensitive medications. You can burn pretty easily on them. And I say that that increases your risk as well. We talk about the longer you're on these medications, the higher your risk goes. And a lot of that is because the longer you're immunosuppressed, your body just can't attack those atypical cells that create skin cancer. So when we talk about which of these people is most likely to have a skin cancer, this is the patient that we see will be at highest risk. She's light skin, light hair, light eyes, and she's had a lot of sun over her lifetime. So that risk will increase as we age. When we talk about who's more likely to get skin cancer in this photo, we have on the left, we have the 63-year-old nun and the 63-year-old farmer. And you can clearly see that the damage is a little bit different here. We know that sun causes aging, sun causes skin cancer, sun causes wrinkles. So you can look to the left and say, hey, she probably hasn't aged much. She hasn't been outside. Whereas we have our farmer here who's had a lot of sun damage, and you can even see on his face some of that damage. So that history of sun exposure really increases his risk for skin cancer. Now, transplant patients, you guys have an additional unique risk like we talked about. So this is why we really need to be aware of that. Your type of solid organ transplant does matter to your risk, the age at transplant, and the type of immunosuppressive medication that you're on. So here we have heart, kidneys, lungs, they say are the higher risk transplants. People ask me what it is. Is it the organ? Is it, why am I higher risk? And I get this a lot from the patients that I see. My clinic specifically is about, I would say 70-75% solid organ transplant patients. So this is probably one of the most common questions. Is it because I had a heart? What is it? Like, why am I at highest risk? And actually it is because a lot of times the heart, kidneys, lungs, you guys need 3 immunosuppressants. I can find that a liver transplant patient can get down just on tacrolimus sometimes without rejection. But our heart, kidneys, lungs, it's rare that I see, especially hearts and lungs, get down to less than 3 immunosuppressants. So like I said earlier, the more you're on, the higher your risk is.
Hey, Naomi.
Yeah.
Not to throw you a curveball, but have there been any studies done to say and hone in and drill down on specific meds and the percentage? Like if you're on tacrolimus, you're more susceptible, you have a higher percentage rate, or mycophenolate, or
So there isn't a percentage per se, but tacrolimus and mycophenolate have both been, and azathioprine are actually 3 immunosuppressants that we have seen really drive skin cancer. So there are studies done in those 3 medications specifically. And that's why your transplant team should be working with you. You'll get your tacrolimus levels. They try to decrease those doses to as low as they can where you won't reject. Okay. So that's why they're so specific about that. And usually what happens, Bill, is that if we start to see a patient makes 3 or 4 skin cancers, and I'm starting to, like, on every visit that we see them, we'll reach out to your transplant coordinators and say, hey, or the physician themselves, the nurse practitioner, the PA, and say, I'm a little concerned. What can we do here? Where can we adjust some of these medications? And sometimes they'll just bring your doses down. And
Right.
something as simple as bringing the dose down may slow those skin cancers down.
And Bob's asking about prednisone. Does
So
that have it?
Yeah, so prednisone is not specific, and I get this question actually a good amount, and I can't say for sure. I don't think there are specific studies on the prednisone, but because the prednisone is immunosuppressing, that's just the factor of why that increases your risk. But I don't think there are specific studies saying that prednisone itself revs skin cancers.
Okay, thanks.
Yeah. So this talks about age at transplant. So why this matters. So under 30 years old, it says the average age is it takes about 22 years, depending on your skin type, to get that first time skin cancer. But over 50 years, you may see that between that about 11th year. Now, I still tell my patients the most common they say is about year 2 to 5 post-transplant is when you start to see those skin cancers can develop. You've been immunosuppressed now for 2 to 5 years, and your body's kind of saying, okay, I'm not going to attack those weird cells that I made over my lifetime of sun damage. So this number, I always say, is the average number, but I still like to keep in that 2 to 5 year post-transplant when I counsel you, because I want you to start really being aware and looking for them. So, and this kind of is a good way to talk about that prednisone. So no matter what, all immunosuppressants indirectly increase skin cancer formation. So that was like a good question when we say the prednisone, it suppresses your immune system, but it's not specific to revving those skin cancers, but it's still part of your regimen that can cause that. All right, and like we said, the longer the duration is higher the risk, the higher the dose, higher the risk. So if you're not somebody who sees our pen transplant dermatology team, what I would recommend is that you have the conversation with your dermatologist about, being aware that you are higher risk, that when you start making more skin cancers, that they need to be in touch with your transplant team. All right, so Beth is going to take on the decreasing your risk for skin cancer here.
All right, so I'm going to start with just some tips on how to decrease your risk for skin cancer. So staying safe in the sun. Of course, this is going to be super important going into the holiday weekend. So the sun emits ultraviolet light, so UVA, UVB, and UVC. The UVC is absorbed by the ozone in the Earth's atmosphere. So just the fundamentals about ultraviolet light. So the short-term effects of UVB is sunburn and tanning. And then the long-term effects of UVA is premature aging, dark spots, wrinkles, and increased risk of skin cancer. This is my son last year with his sun protective clothing on. Hopefully he never knows what a sunburn will be in his lifetime. Helpful, but we'll hope.
What a cutie.
Yeah, oh, thanks. So compliance with sun protection measures sorry, can you go back one?
Now it's there we go.
So we know that compliance with sun protection measures is actually poor in organ transplant recipients, especially in patients greater than 50 years old and men, which actually doesn't surprise me because men don't like to put really much of anything on their skin. So, so this here is an example of a patient, a kidney transplant patient who was on Prograf and prednisone. He worked on a ferry for his entire life. So obviously had a lot of sun exposures and had at least greater than 50 skin cancers in his lifetime, and we treated a lot of them at Penn, and he spent a lot of time with us, but this is just one example. So which is the most effective way to protect your skin from the sun? Avoiding sun exposure, sun protective clothing, or sunscreen. So obviously avoiding sun exposure is ideal. Now that isn't always possible because obviously we want you to get outside and enjoy your, enjoy the few months that we have of nice weather. So just going to go through some things that you can do to protect yourself.
That's why mushrooms never get cancer, right?
So UVB intensity peaks from 10 a.m. to 2 p.m. So avoiding these peak hours is ideal. So if you are going to be outside, trying to go earlier in the morning, later in the afternoon, that's obviously ideal because you're avoiding those peak hours. This is just a little graph there. So what else can you do to protect yourself from the sun? So this is a nice saying that we tell patients. So slip on a shirt, slap on a hat, slap on sunscreen, wrap on sunglasses to protect your eyes and sensitive skin around them.
So fun fact about this saying, I did not know this saying until I got into dermatology. And I recently, in the last year, I inquired a patient who lived in Australia. So he moved to Australia here during the middle of the pandemic. And he and I were doing a skin exam. And then we were talking about this saying and the ABCDEs of melanoma. And he says, oh, yeah, I've known that since I was a child. Slip, slap, slop, and wrap. And I'm like, what do you mean? And I was like, I've literally never heard this phrase. And he goes, in Australia, we have commercials that talk about slip, slop, and wrap. And they literally know this phrase from like the time they start elementary school to, adulthood. And I thought that was so interesting how their sun education is so different than ours. But now every time I see this, I think about him because I'm like, wow, he's known that entire phrase his whole life. And I've only known it a few years. I'm like, we are doing something wrong here.
But they still always have the highest risk of melanoma. So
they do. And that's probably why they teach their children so young. I mean, he told me they would not go outside for recess without sunscreen on. And I was like, our kids are like, our teachers are begging parents to pack a thing of sunscreen, but they say only if your child can put it on themselves, which is so interesting. But I love this phrase and always think of them now.
Well, it's one thing to be able to say it. It's another thing to be able to do it.
Yep.
Right.
Yep.
So sun protective clothing is a really nice option. I actually do send my kids to school in sun protective clothing because I'm that mom, because I don't trust that the teachers are going to put sunscreen on for them. So sun protective clothing actually does give us a lot more protection than just your average clothing. So we generally recommend that you look for ultraviolet protective factor 40 to 50 or higher than that. Really, honestly, 50 is ideal. And those fabrics are really protecting a lot. They're giving you about 98% of sun protection. They're also a nice option, when you're not having to remember to reapply and, do all of those things while you're at the beach or, outdoors enjoying yourself. If you just have sun protective clothing on, you don't have to remember like when was the last time I put sunscreen on. And usually these the sun protective clothing is really nice and lightweight, a lot of them now, and more widely available, which is nice. So like I had mentioned, the sun protective clothing with the UPF tag 40 to 50 is ideal. Anything lower than that, you're just getting less of the sun protection. So you do want to make sure you're looking at that number. Here are just some examples of things that, the tags that you can look for and brands that, you can find out there. Coolabar is a really good one, UV Skins, but really a lot of brands have now offered the UV protective clothing.
So Beth, where do you typically buy this stuff?
So I buy a lot online. Amazon has some nice options, but I do see them in stores like TJ Maxx, most like sports stores are going to have them. Coolabar, the one that I had mentioned, has really nice like golf shirts. They also have UV protective sleeves that you can buy separately. You can also get those on Amazon. So if you are wearing like a t-shirt and need coverage on your arms, you can take them on and off.
So I'm glad you mentioned that because I am a cyclist and I do have a whole series of those UV sleeves, some of which have like tattoo designs, and people think that I actually have tribal tattoos on my arms. But I'll tell you what, You would think that these things would be hot in the summer, right? But I got to tell you, when I'm out cycling on the chilly mornings, they keep my arms warm. And then in the sun, they keep my arms cool. So you perspire, and then it has wicking properties. So these are the greatest things. And I recommend them, especially to the guys that don't like to put on sunscreen all the time. Get some of these sleeves that Beth's talking about on Amazon, or message me and I'll send you some links. But I have all different colors and designs, and they're great.
Yeah, I agree. They are great. You do have to be, one thing with the sun protective clothing is you do have to be conscious about how much you're washing them, because they do lose a little bit of the effectiveness. So they say about 100 washes you should, invest in new products, but that generally lasts people pretty long. So. And these are just some examples of some UV protective hats. So in terms of hats, we really do ideally want you to have a wide brim hat, or something like the one on the bottom right that is covering your neck, your ears, and the sides of the face. The one photo here with the man with the baseball cap, obviously his ears are exposed, his neck is exposed, the sides of his cheeks are exposed. So you're really not getting the cover you need. And a lot of times these areas are, forgotten, and you're not reapplying sunscreen to these. So men, honestly, the most common place for them to have skin cancers is their ears, because they have shorter hair. They're wearing baseball caps, so the ears are exposed a lot of the time. Dr. Miller, one of our Mohs surgeons, his rule of thumb is if people aren't making fun of your hat, then your brim isn't wide enough. So the wider the brim, the better. He generally wears that one hat on the bottom right. So he's usually almost completely covered when he goes out. So this is just a good example of areas that are exposed that are getting sun exposure. So you can see, obviously, in the first photo here, he's wearing a baseball cap. So his forehead, it really isn't getting much sun, but everywhere else, his neck, his cheeks, even his nose, obviously the ears, they're all exposed. And so these are areas that we can't forget, because we are, these are always exposed to the sun. So you want to make sure that you're wearing sunscreen year round, and covering up all these areas. So talking about sunscreen, there are lots of sunscreens out there. It can be extremely overwhelming when you are looking for sunscreens. There might not, you might buy one and not like it. So generally our rule of thumb is find one that you like and that you're going to use. There are other criteria that we generally tell people. You want to make sure that your sunscreen is broad spectrum, so it provides protection against UVA and UVB. You want to make sure that it's water resistant. They used to use terms like waterproof, sweatproof. Now it basically just says water resistant, and it should provide anywhere from 40 to 80 minutes of protection. So there are chemical sunscreen and physical sunscreen. So this is something that I think people are a little bit more aware of recently, the differences between the different types of sunscreens and what they're doing. So your chemical sunscreens, they work by absorbing the UVA and UVB rays. They take about 20 minutes to be effective. So if you're going to use a chemical sunscreen, you want to make sure that you're putting it on before you're going outdoors, about 15, 20 minutes prior to. There are typically a bunch of active ingredients in there, but again, they're working by absorbing the UVA, UVB rays. Your physical sunscreens are they're bouncing off the UVA and the UVB rays are bouncing off that sunscreen, so it's effective immediately. Typically, these have a zinc oxide and titanium oxide in them, or titanium dioxide. They tend to be a little bit thicker and go on kind of in a more white consistency. So some people don't like that. I generally try to find a combination of both that I will, for the body. Sometimes I use more chemical sunscreens versus the physical sunscreens just because they might be a little too thick for me. But case, I'm almost always using a physical sunscreen.
So Beth, is it fair to say the chemical stuff is the spray on things in the aerosol cans?
Yeah, so actually you can find a lot of physical sunscreen. So your zinc, they have a fair amount of zinc sprays, which are actually kind of nice because they're not as thick as your lotions are going to be. And they also are providing like immediate protection.
Yeah, because I like that you don't get all gooped up, right? Because I think that's what guys don't like, especially is we get it in our hands, right? And then we got to put it all over, and then it's all in the palm of our hands, and
yeah,
it's easier to just spray on.
The stick sunscreens are also nice too. They almost look like deodorant.
Mm-hmm.
And like I always recommend for my dad and my brother to use those while they're golfing because they're obviously like, they're gripping the club. But if you use the stick, you're not having to rub it in. You're just putting it directly on those areas. So there are a lot of different options. We really just generally recommend finding something that you like, SPF 30 or higher, and it's going to be water resistant, and that that you're going to use and reapply.
And I just want to touch base, Bill, on those spray sunscreens because the mineral are now, I think they're a little bit newer in the sense in the last few years, they started putting mineral in a can and making them spray. But anytime that you use spray, whether it's chemical or physical, you have to make sure you put it into your hand, to be honest, and then spray it on. Because the issue, I think, with the spray sometimes is people will just spray it and then kind of let it mist into the air, but you're actually not getting enough on your skin and you're also inhaling it. So that's the biggest concern when we talk about those spray sunscreens is that they're a little bit thinner, which is nice than the goopy stuff you'll get in your hands, but you should still be spraying it in your hands and then putting it on.
Yeah, so typically I notice that since we have hairy arms and hairy legs, right, when you spray it, usually the hairs get it. And then I rub it in and then I end up having it on my hands. But then that's when I go to my neck and my ears to get rid of all that stuff, right? My forehead, my nose. And
perfect. As long as you're not doing one of those spray and run in. Yeah, I think.
Yep.
Okay. And I just want to be like, excuse me, just to let you know, you're not protected. But here you go. So this is a perfect.
Oh, okay, there you go. People apply about 25 to 50% of the amount of sunscreen used in testing for SPF. So people are not using the amount that they should be. So again, the top sunscreen recommendation that we're going to give you is the one that you like, and then the one that you will put on the skin. If you see us in the office, and we a lot of times will give you, recommendations on ones that we like, but really, honestly, just finding one that you like and will actually use is most important. All right, so again, just to recap, use a sunscreen with the highest SPF that you like using. Apply a sunscreen, particularly chemical sunscreens, 15 to 30 minutes before you go outside, and apply liberally. So good rule of thumb is that at least 1 teaspoon per body part. And then reapplying at least every 2 hours. Obviously, if you're outdoors swimming, sweating, you want to make sure you're reapplying. That's most important.
Yeah, and Beth, a friend of mine just recently applied for a position at a sunscreen company and he got rejected. So he reapplied.
Was it 2 hours after he applied initially? Because that was the most important part of that, right, Bill?
Yes, 2 hours after.
That may have been the problem.
Yeah. Also, great tip, sunscreen is the most effective anti-aging product you will put on your skin. So you're preventing wrinkles and sunspots as well. So this is just an example of a patient or a truck driver, not a patient. He was a photo that was going around on the internet a few years ago. And you can see the left side of his cheek and around the eyes and forehead actually has a lot more sun damage than the right side because he was in the car driving and all that sun exposure, came through the window. So you can really see the difference in the skin texture, and he probably had more skin cancer on that side as well. So,
well, I heard this guy was from the UK.
Yeah.
Well, so this is a great example, though. They kind of did it where they said, like, if he had sun all around, that this is what he would look like with the
He would
sun,
look like,
right? Yeah, and then that's if he didn't have that kind of sun damage on the left.
Mm-hmm.
You really see that aging. All right, so I'm going to jump in and just talk a little bit about facts and myths. So rigorous sun protection can cause vitamin D deficiency or insufficiency. So people have asked me this. I know that more people probably say, no, like you can't put on that much sunscreen to actually get vitamin D deficiency. But it is actually a fact. So if you're really good with your sun protection, if you are in those UPF clothing, if you are sun avoiding, and you are sunscreen every second when you're out there, it is actually a fact that you can have some deficiency. So there was a study that talked about this. So if that is the case, I would recommend, if you are being that diligent about making sure your levels are checked, and also talking to your transplant team about supplementing the vitamin D. Other ways you can get vitamin D from natural sources. So you can take it pill form, but you can also milk, eggs, cheese, fish, sunflower oil and butter. This is all good ways to get just natural vitamin D to change out for the sun, the vitamin D we get from the sun.
Naomi, excuse me. So when you take like a vitamin D supplement, is there another supplement you have to take in addition to that for the proper absorption? Or am I thinking something else?
So I want to say you could be thinking magnesium.
Not that I'm aware of. I mean, my vitamin D has been low since I started working in dermatology. So there's a range in your vitamin D. So if your vitamin D is like really low, generally we recommend higher doses in the beginning when you're supplementing, and then kind of, going to more of a normal dose of vitamin D. But it kind of depends on where your numbers are. But yeah, typically your primary care is making those recommendations.
I think you're thinking calcium though, Bill. Like there are certain, right? Calcium, magnesium, I think is the one that you have to take to help absorb.
When you're on long-term prednisone, maybe like calcium, vitamin D, we will do with prednisone, but
definitely take that up with the transplant team. But I am not under the impression that you need to take something else to help the vitamin D absorb.
Okay.
So the factor myth here, if you stay under a beach umbrella, you don't need sunscreen. This is absolutely a myth. So if you are out on the beach and you have an umbrella, you should still be putting sunscreen on any of the exposed areas. The UVA, UVB rays can actually reflect off of the sand, the water, and get to you horizontally. So really you need to be doing everything you would be if you didn't have an umbrella over you. So you can see here, it reflects about 17% of UV radiation. So if you're relaxing under the umbrella, just make sure to put everything on that need be. So here's a good study from JAMA Dermatology. This is a 2017 study, but they did find that 80% of people who sat under the umbrella for at least 3.5 hours without sunscreen had some degree of sunburn the next day, compared to the 25% of people who used the high SPF sunscreen and stayed out of the sun. So this was despite the fact that the umbrella material allowed no UV to penetrate. That means when we talk to you guys and say, do you use umbrellas on the beach? Are they UPF umbrellas? And you tell me yes, that does not mean that blocks you from still putting on the UPF clothing and sunscreen, because it's still penetrating and reflecting off of the sand. And the participants in the umbrella group were monitored to ensure that they got no direct sun exposure, but they still were getting some portion of the sunburn. Protect yourself. This is also a really good one. I love this one because if it's cloudy outside, you don't need sunscreen. People say that all the time. It's a rainy day. I'm going outside. It's cold outside. I don't need sunscreen. This is an absolute myth as well. Just because you don't have that hot factor, you're not out there and feeling the sun on your skin, that does not mean that you are avoiding those UVA, UVB rays. They are still out there. So this is why it's so important to do your face, your ears, your neck with sunscreen every single day when you get out there. And if you're going to be outside for more than an hour, you really should have sunscreen on everywhere that you're exposed or having the UPF clothing on. So clouds only block about 20% of this UV radiation from the sun. So you can still get really sunburned on a cloudy day. I am guilty of actually doing this when my kids are playing sports. I have worn short sleeves and thought nothing more of it when there was not a big sun out and I wasn't sweating. I was like, oh, it's not a huge deal. I'll just throw on a baseball cap and go out there. And I have definitely gotten burned from it. So they take away that warming warning that I was just talking about. So tinted windows help block UV light. This is a kind of one where we're not 100%. So this is fact and myth together. And the reason we say that is because there are certain tints that actually block UV rays. So you need to have that specifically on your car versus just the regular tinted windows. So this is why it's a little bit tough to say that they block them out, because we don't really know what anyone's putting on your windows. You have to either go to the actual dealership or wherever you're getting it and making sure it does UPF protection, but I don't think that many of them do yet. I think it will help with decreasing some of the UV light, but at the same time, I still think you need to be getting your sunscreen on. So the front windshield and side windows of a car block 95% of UVA rays, and that is also a myth. We get sunlight through everything. So sunscreens that contain insect repellent are as effective as using the two products separately. And this is a myth. So do not buy those sunscreens that have the insect repellent in them. This actually has to be put on separately in order to get the maximum protection for sunscreen and for your insect repellent. So the American Academy of Dermatology recommends that these products be purchased and used separately. What you're going to do first is put your sunscreen on, and then you do the bug spray afterwards. But the sunscreen needs to be in that generous, the teaspoon per body part before you put that the bug spray on. So insect repellent should be used sparingly and much less frequently than sunscreen. So kind of just to recap, we come back to staying safe in the sun. So the big thing is sun avoidance, sun protective clothing, and sunscreen. And then we're going to start talking about how to detect your skin cancers. What do these skin cancers look like? Every month you should be doing a self-skin exam. I tell all my patients, pick one day, usually the birthday. So my birthday falls on the 23rd. So every month on the 23rd, I would just do a brief look over of my skin and just say, is there anything new? Is there any unhealing wounds? Was that there last month? Has anything changed on me? And I tell my patients, your job is not to really tell me if it's a skin cancer, but to know if something is new or changing, and then give me a call and come in and see me. So I will pass this over to Beth. Oh, Beth, I don't think we can hear you.
Sorry about that. So early diagnosis of skin cancer can save lives. Almost all skin cancers start at an early curable stage. So squamous cell carcinoma, we talk a lot about with our transplant patients. So 65, the transplant patients we know are 65 times more, they're 65 times more common in transplant patients. How to look for these? So they're usually pink and scaly, tend to be in sun-exposed areas, and may develop from a precancer, or what we call an actinic keratoses. They're usually pink or red spots with a rough surface. So you can see here in the photo that the spot on the left, yeah, maybe new, maybe a little bit pink, but over time is then kind of transformed into the spot on the right, which definitely looks like a squamous cell. Basal cell carcinoma, so you're 10 times more likely in transplant recipients to have basal cell carcinomas. They're usually small pink bump or patch on the skin, also generally tend to be in sun-exposed areas. And these tend to bleed or kind of get some like superficial kind of scale or crust to them that will, recur and kind of come back, if it falls off, may come back a few weeks later. And then lastly, melanoma. So you're 4 times more likely in the transplant recipients to develop melanoma. These are generally tend to be the pigmented lesions that we're looking for. So it's an irregular brown spot, changing mole. So something that's new on your skin, a mole that you've had that now you're noticing the borders are a little irregular, or there's darker areas in this mole that weren't there before. Maybe it's symptomatic. Is it itchy? Are there other symptoms in the skin? It's fairly easy for us to do biopsies. So for my transplant patients, I'm very I try to make them very aware of what's on their skin, and to really try to contact me as soon as they can if they have a new spot that they're worried about. Squamous cell carcinoma can be very aggressive in transplant patients. So I'm looking a lot of the times for, obviously looking for all of them, but for these spots particularly. So back to melanoma. So you're looking for the ABCDEs. So asymmetry, border irregularity, it's greater than 6 millimeters, the diameter, and then it's evolving. Sorry, I think I had gone through that. New moles. So looking for monthly self-skin exams. So like Naomi had mentioned, she does, we always recommend that patients kind of look over their skin once a month to make sure there's nothing new or changing. Don't forget about the underarms, the palms and soles of the feet, the fingers and toenails, the back, the buttocks, and the genital areas as well. So skin cancer screenings by full body examination should be completed by a dermatologist, and then continue standard skin cancer surveillance as recommended by your dermatologist. So we say at least once per year for transplant patients, but if you've had a history of skin cancer, you've had a family history, we might be doing them a little bit more frequently than that, depending on what your own risk factors are.
And if you do get a skin cancer, we do like to see you every 6 months. If we start to note that you are making multiple skin cancers in a visit, we'll start to see every 3 to 4 months.
All right, so take home message, you have the ability to decrease your risk for skin cancer by using sun protection, doing all the things that we have gone over tonight. And then you have the ability to detect skin cancers before they're dangerous. So self-skin exams, and then, checking in with us as we recommend. All right, so feel free to ask any questions in the chat, or feel free to unmute if anyone has any questions.
So I wanted to do a public service announcement. We were talking about this prior to going on the call here. About the sunscreen recall that happened last year and may even be trickling into this year. So you guys want to Google sunscreen recall to see if any of the sunscreen products that you're using is on the list. They even have lot numbers. But basically benzene, which is classified as a carcinogen, was added to some products by mistake. And benzene's typically used in the production of like synthetic products, rubber, plastics, lubricants, pesticides. So long-term exposure can lead to damage to the immune system. Go figure. And can cause serious health conditions, including anemia and cancer. So public service announcement is check to see if your products are on recall. And I also want to put in a plug for the TRIO post-transplant cancer website. And Jim, do you want to talk about that for a minute?
It's an excellent resource that you can find on your browser. Put in TRIO web PTC, posttransplantcancer.org. And there are 45 pages of well-organized information And the majority, of course, is about skin cancer because that's the most prevalent challenge that we face. And it was purposely addressed mainly because it's an area where people lose their focus. So by having webinars like this and by providing a resource like that, we're hoping to put in the hands of medical professionals something they can give their patients. And by organ type, you can understand the different levels of risk for cancers. And then secondly, a level where you can look to find out what are the symptoms you look for? What are the preventative tests you can get into, for example? And once you have that in your education mix, then basically, how are you going to live with cancer, that higher risk? Very simple. It's prevention, as you've been talking about a lot today, diagnosis, treatment, and long-term recovery. And so the message is exactly what we've said here today. If you catch this stuff early, it becomes part of your long-term story. If you don't, it becomes the epitaph on your tombstone. And I got to tell you that early on, my attitude was, and this was borne out by the dermatologists I saw locally. They weren't transplant specialists. They were just dermatologists. And I was very fat, dumb, and happy letting them take my advice of, no, I'm fine. Okay, anything you look at? No, not really. Good. And I got away from it. And then, of course, I met Dr. Miller. And I found out what it's really all about. And, when he started at the tip of my head and went down to my toes, I said, what the hell are you doing? And that's the way it should be, especially for us with higher risk. And so I took him a sombrero one time. I wore it into clinic and it had a label on it, just as you had said about him. If they're not making fun of you, the brim's not wide enough. And I gave that to him as a gift. I hoped he would put it up on the wall someplace. So
I remember that sombrero. I was working with him at that time. It was great.
I wonder what I ever did with it, but it was my way of affirming the great work he was doing. And again, my attitude was, it's skin cancer. It's on the skin. How bad can it be? And then we had him in, like you did today, with much more emphasis on some graphical representations of what the different skin cancers could be at different stages. And when I realized it could metastasize and through the bloodstream get any place, all of a sudden, and we had a lot of his patients in our support groups, and they raved about him and his program. And it's grown tremendously since I first started going there, which is probably now 14 years ago. And the difference, once I understood that, and I can remember one of the graphics was a heart transplant recipient out 17 years, and I'm sitting in this audience 17 years out with a heart transplant, and he's showing me a picture of a guy whose face is totally opened up. And I'm like, oh my God. And he went on to explain this guy is one they were working on, and he came in too late. And 4 months later, he was dead. Guess what? I signed up and came down with his program, and I can't recommend him high enough. And I'm a frequent flyer. I'm Irish with, bright skin. And he's had a ball with me. I've got a album of pictures down there to beat all, but I'm here telling his story because of his great work. So just be aware of your risk. It's something that most programs don't follow through on enough. And that's why we're emphasizing it and trying to give those programs something they could use with their patients. Trio Web, that's our main website, but the Trio Web PTC is the post-transplant cancer one, triowebptc.org. Go on, check it out. And you also have some videos out there of people who are sharing their success stories dealing with cancers. And so check it out.
Yeah, and I want to thank Jim because this has been really something he's put his whole new heart into and soul to put this together as a way, because this affects all of us at some point or another. So check out that site.
As a multi-cancer survivor from prostate cancer 22 years ago, which has now come back, kidney cancer, skin cancer, and that's about all of them. I am pleased to be here to be able to share that story, as opposed to a record you read about. Oh, you remember Jim? Yeah, he died of cancer. Well, I may die of cancer, but it's not because I'm not paying attention. Thanks, Bill.
And I want to give a shout out too to Penn Medicine Dermatology. You know, I was in for my annual checkup with Naomi, and once we released the website, I showed it to Naomi, and before I even left, she had it up on the Epic printout as a resource. And you know, if you do go to Penn Dermatology and you know you get that printout at the end and they always give you something, right? Check out that it actually has the Trio Web PTC address to check us out as a resource. So really check it out. I wanted to see a raise of hands of how many people have dealt with skin cancer since their transplant. Bob Goodman, Carmen, Jim, Sue, John. Wow.
Bunny's clear.
Me and Bunny, knock on wood.
So far.
Yeah. Well, that's good. I mean, but you guys are all here, I think, because you know the importance of it, and you know your risk factors, and it's always good to, I think, hear over and over again, because you know, the more prevalent it is in your mind, the more you're going to practice it. So, Bill, I was going to say really quick, just want to touch base with the benzene thing, because I was going to talk about it at the end. If you have sunscreen left over from last year when the recall happened, it should be thrown out, regardless, because actually sunscreen should get you only through one summer. So if you have a bottle of sunscreen and it's been lasting you for a year, you're not using enough. So get rid of it and get a new one.
That's what we'd always say at the gym, right? You bring a water bottle as you're working out, you're supposed to drink it, and you're supposed to empty that water bottle, and it shouldn't have any water in it by the end of your workout. If you do, then you lose, right? So
yeah, I used to never know that, because I used to use my sunscreens through, like, it's terrible. I'd be like, oh, this is fine from last year, and then nope, they get rid of them. You're not using enough of it. You should be empty with sunscreen at the end of the summer, and then really using it through the entire year. If you have some left, say you got some in August, that should be done by, you know, October.
And does anybody have a question for Naomi or Beth? Bob?
Yeah. Hi, I'm Bob Goodman. I had a heart transplant. I see Dr. Michelle Rosenbach because my underlying disease is cardiac only sarcoidosis. And I have had the pleasure of meeting Dr. Shin once up here, once over here, and a melanoma as well, all of which are all completely clear. But through business that I'm involved in, I've become aware of a service, a company, I guess, called Mole Safe. That's one word, Mole Safe, MOLESAFE. And I'm not trying to promote it, but it's from what I understand, it is basically, it's some sort of camera, and it linked into it is a artificial intelligence app, an AI app that the intent, and I think for the most part, this is a voluntary thing for people to do for themselves, but they take a picture, they take pictures all over, and it's an annual sort of thing. And the AI can help you detect whether something looks different from last year, is additional to last year, or changes, whatever it might be. Have you guys ever heard of, I don't care if it's them, but in general, have you ever heard of anything like that?
Yeah. So interestingly enough, I just had a patient who I did his skin exam for the first time, and he said, "What did you think that was?" And I told him, "Oh, you know, I think this is seborrheic keratosis. It's benign." He goes, "That's great." He's like, "That's what my app told me." And I said, "Which app are you using?" And I think he was talking about the Mole Safe. So it tells you,
Really?
They think it's benign. I think it's that, or it could be a different app, but I do think.
I don't know. I've never used it or seen it, really.
Yeah, that's the picture. So he pulled it out, and we actually went through some of the things, the lesions that I was looking at. And then the one that was questionable, it says, please see your dermatologist, unable to really, you know, discern if this is benign or malignant.
Right, right.
But, you know, and I told him, great app, love it. but that does not replace your dermatologist.
Right.
So,
Oh, no. It was not, I don't think it's intended to do that.
no, and I think you
So-
guys are great, but there are people who definitely think that it could replace their dermatologist. And I said, no, you still
Oh,
gotta.
no. That's, I know one of the investors. That's.
Yeah, But
you
it's
know.
a good tool. I agree, Bob. It's a
Oh, no,
great.
and it's, yeah, he's not a doctor, but he knows enough to know it's a tool.
Yeah.
No, they know that.
Yeah,
And
exactly.
they try and link up their service with dermatology practices.
Yeah,
As
yeah.
opposed to
That's great.
freestanding clinics that aren't tied to a practice.
I think it's helpful. I think it's very helpful. It's hard to know what you should be worried about. And a lot of patients will tell me, I can't see my back. And
Right.
I really don't know if this mole in my arm has been changing. Even if I look at it every month, I still am not sure. So I do think it's very helpful.
Yeah, and in our department, we offer a lot of our patients that have a lot of pigmented lesions. So they've had a history of melanoma or atypical moles, and they just have a lot of moles. We do offer full body photography. So you have,
Same sort of thing.
yeah, you have pictures head to toe. They're good for about 7 to 10 years, and you come to every visit with those photos, so you can see,
Oh,
is this a new mole? You're comparing your photos to the in-person skin check, and then also seeing like if you did have this mole, has it changed at all from the photos? So
I know you're not in this business per se, but when they do those full body photos, is that something that Medicare, for example, pays for?
typically, insurance companies will pay a portion of it. I don't know that they pay all of it.
Okay, so maybe a port. Okay.
Hey, so I'm on the MoleSafe website now. It doesn't look to be an app per se, but they do want you to book now. They're actually headquartered in New Jersey, and they're touting total body photography, head to toe skin check, expert diagnosis, follow-up recommendations, secure online access of your images, yada, 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 right? So
I think at least I don't know if they still do. They had a relationship with the dermatology department at NYU Langone. So I think they were sort of overreading for them or something like that.
well, thank you,
Right,
Bob.
Great resource.
Yeah. Carmen.
I like your
Yes.
gloves, Carmen.
First, great presentation. Great
Thank
presentation.
Thank you.
I see Beth.
Hi,
For years
Carmen.
now.
I'm happy to see you here tonight.
Hi, Beth. Couple things. I use these fishing gear gloves for driving or when I'm outside. They allow use for either phones or gripping farm equipment. I'm a third generation farmer. So that may be something somebody might be interested in. To
Yep.
protect their hands.
Great.
I also use a gator.
Nice. Matching.
I love that we're getting a fashion
I
show.
love
on
it.
top of
I
it.
know. This is amazing.
And then if I'm outside doing anything,
Can't wait for the hat.
Oh, love it.
I'm here.
Yeah, it's coming.
I know. I can feel the hat.
And then I got the Cowtown hat.
That's awesome.
Oh, I love it.
That is awesome. That's perfect.
Amazing.
You are our mom.
Everyone should have sun protection like you.
There you go, Carmen.
So I think maybe the gloves or the gaiters around the neck, because all my years in the sun as a child on the farm, all the neck
Yeah.
redness from t-shirts and etc. CVS Sport 100, highly recommended.
Okay. I like it.
The Neutrogena for the face, the spray.
Awesome.
Hey, I think that's one that's on recall, so check that out.
Okay.
Yeah, there were some Neutrogena and Aveeno, I believe. There were 2 brands,
Okay.
but not all of it was mostly, I think, some of the sprays, but.
Thanks for the heads up. Great presentation.
Hey, Carmen, so when you put on that spray, are you wearing those gloves?
Actually, when gloves off, spray, And then
All right,
gloves on.
I was just testing you.
No problem. I need a test.
Thank
Yeah.
you, Carmen, for sharing that.
Yes,
Does
not a
anybody else
problem.
have any questions? All
It was
right.
a little hard getting on to find the website because I'm a Trio member and I get the newsletter. And when it said join the meeting, I think a participant earlier had some trouble and it wouldn't bring me to the link. So I think we, as you suggested, copy that link and then go into the World Wide Web.
Yeah, we'll have to see what we can do to make that a live link in the future.
Right.
And Bill, I just wanted to kind of put a tidbit out here that in the past, if any of the patients have tried to call Penn Dermatology, there's always like multiple numbers. We have now consolidated that into what we call our PennDoc Connect Center, and they will be doing all the scheduling for all our organ transplant patients and surgical patients. So that number is on here. So I'm going to quick share my screen. It is actually our surgical number. So if you've ever seen Dr. Miller like Jim has, you probably have this number. Let me just pull it up one more time. But this will be the number from now on, Bill, that we will actually be using, this 215-360-0909, to schedule all of our patients and reschedule for all of our locations. So we have the Proman Center, Pennsylvania Hospital Site, and Penn Medicine Radnor that all offer our organ transplant patients a clinic.
Oh, missed it.
Oh.
Can you go back?
Yep, here you go.
215-360-0909.
I was going to take a screenshot of the slide.
Okay, go for it.
Where's it at?
Yeah,
Oh,
you
don't
took
see
it
it
down.
anymore? Oh, no. Sorry, I'm sitting here thinking, all right, do we see it again?
Got it. Thank you so much.
You're welcome. So yeah, Bill, just, anytime you guys are talking to Tria and patients are looking for access for dermatology as an organ transplant patient, they should not have to wait that 3 to 6 month wait. And that goes for return patients, new patients. There should not be that long of a wait time as general dermatology is. We offer this clinic specifically for organ transplant patients. So your time frame should really hopefully be no more than 2 or 3 months to get into the clinic. And then if there's an emergent issue, you should be able to get in within like 4 weeks. So, and that's specific for our transplant patients, and that's the number for you guys. Okay.
Okay, well, if there are no other questions for our guest speakers tonight, I want to thank both Naomi and Beth for joining us from Penn Medicine
Thank you for having
Dermatology in
us.
Philadelphia. And wish you guys a safe and sun protecting Memorial Day weekend.
We'll see you guys later.
Thank you.
All right,
Bye-bye.
bye-bye. All right, and there are a couple other topics that I wanted to briefly touch on. I thank you for your patience. I know we had some technical difficulties a little bit earlier. Team Philly is having a virtual meeting Thursday. You should be getting an email if you haven't already from Kelly on the Team Philly meeting. I don't think there's anything else I want to add to that. We talked about last month our feelings with the games. Monkeypox. Here's a topic. Anybody see this in the news? Anybody have any comments on this? Yeah, just stay tuned, right? Again, I want to remind everybody, if you're tracking this COVID, things are on the rise. So people are carrying it and they're asymptomatic. They don't know that they have it, or they've had COVID and they aren't experiencing the signs and symptoms like somebody that just got it would be. So you need to be extra careful out there. Don't let your guard down. A lot of us have gone this far to just slip up on one little error. It could be detrimental, right? So just be careful out there. Does anybody have any comments, anything they want to add on the COVID topic? Does anybody have anything that they would like to add? I want to remind everybody that next month is our June meeting, which we will have a procurement surgeon from Penn Medicine. She was featured in a Facebook post that Sue Kelchner had seen, and she will be joining us. That will be our last meeting before we break for the summer in July and August, and then we will return in September. So I hope you'll join us next month for a very interesting topic on organ procurement. With that, I just want to thank everybody for joining us this evening and wish you all a safe and healthy Memorial Day weekend. Stay out of the sun.
Thank you, Bob.